Worn dentition. Worn dentition due to carbonated beverages, energy drinks, or maybe acidic environment and gastric reflux. This is a very common problem nowadays. A lot of our patients present with smaller than normal size teeth, erosions, high sensitivity around the gum line, and smaller and smaller teeth, smaller and smaller bite. So we have to address this problem before it's too late. I am Dr. Antoanela Garbacea, and today I'm going to present one of our patient situations, how we address the problems and how we end up treating this situation. Here's a mild loss of occlusal vertical dimension, loss of bite, and mild to advanced worn dentition. Our patient is a very handsome patient, and he presents with situation coming from a general dentist. General dentist said he can't help him anymore, and indeed, he wasn't able to chew on both of his right and left side. So observing his radiographs, we understand that the teeth have been treated with some root canals. There are some more or less adequate restorations. We have some of lost restorations, loss of an implant crown over here on the lower right side. We do have loss and cavitation, a little bit of erosion, occlusal erosion, incisal chipping. Okay, and spaces that he has never closed over the years, a lot of spacing. We discussed the opportunity for him to address closing the spaces with orthodontic treatment, and after that, placing final restorations. Orthodontic treatment was declined. So what do we usually do in this situation? We are offering a smile design. We are designing a digital wax pattern, and we propose a new smile and a new bite all together. When we have a little bit of erosion, we have a little loss of the vertical height of the bite. We like to enhance that, and we increase the bite for prosthetic convenience. So patient accepted finally to go for minimally invasive restorations. That means crowns on every single tooth, which will assist that in closing the spaces between those teeth, addressing every single tooth individually with a restoration, ceramic restoration. So the next step will be to have our patient wear provisional crowns. It's a proposal that starts with milled set of crowns in segments, 3 segments on the upper teeth, 3 segments on the lower teeth, where we start developing phonetics, aesthetics, and a good bite design. Our patient wants to be able to chew on both sides and at the same time, feel comfortable. His muscles should feel very comfortable as well. He presents with healthy joints, so that's not a worry at all. Once the temporary crowns have been installed, they will be in function for 4 to 6 weeks, sometimes even 2 months. On top of the provisional crowns, many times we offer a night guard, so the patient also experience functioning when sleeping within this time with a night guard. Once we are happy about every single detail of those new restorations, we are taking final impressions. The final impressions workflow, we combine a digital version with a physical version. So we still make dies, we still articulate master casts, we still have this normal traditional laboratory work, but we incorporating a digital design. So the digital design around perfectly healthy gums, perfectly healthy teeth, we're designing the final crowns, final prosthesis, as you can see right here. And our material of choice, because we are encountering heavy bite forces, our patient is able to generate heavy bite forces. We have chosen a strong zirconia ceramic material. And as you probably saw in other of our videos, the workflow is the same. We are processing the crowns by milling, and we sinter them, and we attach beautiful ceramic fluid glaze as myostain. So we are able to generate full contour monolithic restorations, one piece with myostains and structure system, and bringing the beautiful life and color out of these restorations. In a full design, these are the final restoration. We usually use strong cements, resin cements to cement the ceramic restorations. And we want to make sure that the motions, forward back motions, protrusive motions, and the lateral motions are very in much harmony. Okay. At the end, we want to make sure that all our restorations are seated properly, the margins are sealed, and the bite is comfortable. As I mentioned, there is a tremendous benefit to actually take the action sooner than later, because we do have this acid environment that continuously erodes the teeth, continuously creates uneven bite in the posterior, and all those problems progress towards worst situations where more than one tooth has to be extracted. Ultimately, a final night guard is processed and placed around the final restorations. Patient is able to protect the beautiful restorations with a night guard. And I hope I enlighten you when I present one of the common situations in our office, and feel free to, enjoy this presentation. Thank you.